Well, we're just really thrilled that Dr. Tripathi has agreed to join us today. Micky's got a long and storied history that's not easy to summarize, but Micky, we really appreciate you joining us today, and looking forward to your comments. Thank you.
Great. Thanks a lot. Thank you, Chris, and thanks, Mohsen. I'm really delighted to be here. I thought I would cover what we're doing in public health in particular, given the nature of this forum and the audience, and certainly happy to cover any other ground. But I'll use that as a way to talk about some of the key initiatives that ONC is working on as well, because there's a lot of interaction and collaboration going on now between ONC and CDC along to kind of address a lot of the sort of public health challenges that we faced during the pandemic, and using the resources that that we now have available to be able to think about how to be able to leverage all of the the various levers and mechanisms that the CDC and ONC have together to be able to help move us forward in better ways than we might have been able to otherwise. So let me just begin, I guess, with framing that a whole bunch of sort of the thinking that's going into this is coming from a work group that was established to respond to an executive order from President Biden related to ensuring a data-driven response to high consequence public health threats, and in particular focusing on interoperability of public health data systems, looking at how they performed in this current crisis and how they're performing. We're not out of this current crisis, but how they performed and how they are performing in this current crisis. What lessons can we draw from that, and then how do we use that to think about how we want to make investments in the future? And that's an interagency work group that I co-chair with Dr. Dan Jernigan, who I'm sure many of you may know from the CDC, and we've been hard at work since the spring, working on the assessment of the current public health data systems, identifying gaps, and thinking about how that sort of helps to inform the future vision of where we'd like the public health system to go at large. And so a number of things, and that work is underway. A lot of it is iteratively sort of informing the data modernization initiative that I'm sure many of you are familiar with, that the CDC and Dan is leading. But we also have a number of very specific things that the CDC and ONC are working on that feed directly into the data modernization initiative. So let me just call out some of those. First is thinking about, in general, about how we can have an enterprise architecture that that accomplishes a number of things. One is that it allows us to be able to get the benefits of cloud infrastructure and all that implies for the ability to get lower unit costs for anyone who is using the system, the ability to have easier sharing of tools, of data, and opportunities for collaboration across different users. In this case, maybe it's different jurisdictions. And being able to sort of make that as something that's flexible, also that meets different jurisdictions and different different stakeholders where they are. Meaning that some jurisdictions, some stakeholders may want to completely maintain their own infrastructure, and they want to do that in whatever way they want to do, and that's that's totally fine. That is their choice. But other organizations, other jurisdictions may want to say, I'd rather be a tenant on a large enterprise cloud, and then be able to get the benefits of lower costs and not having to maintain that myself. And of course, I think, as all of us know, with modern cloud infrastructures, you're not having to compromise local control when you do that. And I think that's the advantage that we have right now as we think about this particular moment in time, and the challenge that we have in our public health systems of not having enough systemness in our public health system at large. When we take the federal, the CDC, and all the jurisdictions, I think we would all agree that we don't have enough systemness in that system. And so this is one way of being able to say, using modern technologies, we're able to get the benefit of high scalability without any particular jurisdiction or any particular user losing their local control in the ways that these cloud environments now allow. So we're spending a lot of time looking at how would we think about that? How do we think about that in a way that allows the the jurisdictions to have this serve their needs where they want and where they are and where they want to be, but also tries to get as much benefit as we can from from the scalability and the other features that a modern cloud approach would allow. Another thing that we're working on, and this is very specific to things that ONC in particular is helping to drive outside of public health, just generally in the market, is is fire. So we've launched with the CDC a fire accelerator, a public health fire accelerator that's called Helios, I think is the brand that we settled on. And that's led by the CDC with ONC directly supporting it as well. And for those who are familiar with fire accelerators, it'll be very much in that model of a public-private collaboration through HL7, the standards organization, and welcoming participation from federal, state, jurisdictional partners, as well as the private sector in a collaborative model to identify what are use cases that could better serve public health and that would be uniquely served by enabling fire-based capabilities. And there are a number of those that I think that many of us can bring to the table. And so that process now that's just getting underway will be to engage engage the public and engage in a collaborative process to say, what's that long list of potential projects, and then how do we narrow it down to a set of 2 or 3 projects that we can do in the first year, which is how the fire accelerators normally work, to have a specific discrete set of use cases that we can all roll our sleeves up on and try to forward those for for the betterment of public health and with the the benefits that fire enablement can bring to the table. So we're really excited about that. That's been a long time coming, actually. So we're really happy to see that launched, and we welcome everyone's participation in that as we move forward here. The second thing I would specifically point to is data and data standardization. One of the things that I think we've all seen as a part of the pandemic response is that we don't have enough standardization of public health data across the country. There's there's just variation in every jurisdiction that's driven a lot by local needs, I understand, and local authorities for sure. But the opportunity for us to be able to say, is there a model for us to be able to move forward with what might become a more uniform public health data model that's building on the foundations that we already have that, that cut across all jurisdictions. And in particular, we're focusing on the US CDI, the US Core Data for Interoperability, which is a standard or a set of standards really that's promulgated by ONC and is a requirement for all certified EHR vendors to support. And as you may know, 95% of providers in the country, that's hospitals and ambulatory providers, are using EHRs that are certified by ONC. And so the US CDI, in many ways, is sort of the minimum data set of the healthcare delivery system. And what we're working on is an initiative. This is a general initiative that ONC has that we're calling USCDI Plus, which is to work with particular partners like the CDC, for example, that have a specific use case, in this case, public health, and that want to move beyond where the US CDI is, because the US CDI is, because it applies to all providers, it's, conservative by design. And so we have an initiative, a specific initiative that we've launched with CDC, that's the US CDI Plus for public health, where we're starting to look at that and say, how do we start with the US CDI and then build the additional data elements that we want to be able to have for public health, and then go through a process of vetting those, making those into a set of published standards that ONC would approve and make available and publish. And then maybe that even goes further into certification requirements. It could start with voluntary certification requirements into EHRs, and then ultimately, required certification requirements for all EHRs. Those would be things that that we would figure out over time. But the important point from our perspective is to say we all start with the US CDI and we build from there toward a more unified public health data model for the country. So that's work underway, and we also are figuring out the ways to be able to get input from all of the states and jurisdictions as well as from the public. The last thing I'm going to point to, because I know we have a relatively short time here, is TEFCA, the Trusted Exchange Framework and Common Agreement. For those who aren't familiar with that gobbledygook kind of name, it's nationwide interoperability. So 21st Century Cures, the 21st Century Cures Act from 2016 directed ONC to create a governance model for network-to-network interoperability across the country. As many of you know, and California has multiple HIAs just within California, and across the country we have lots of HIAs at the state and local and regional level, as well as multiple HIAs at the nationwide level, Commonwealth, Care Equality, the Health Exchange, others. So we're working on a governance framework that would apply a common governance to all of those so that they can connect up and you have that legal common rules of the road scalability, as well as a technical framework for them to be able to connect with each other. And one of the things that, that we're insisting on as a part of that, we meaning the federal government and ONC in particular, is that public health be at the adult table, as it were, of nationwide interoperability. As many of you may know, right now, public health agencies don't participate in those nationwide networks for a variety of reasons. And we want to be able to use TEFCA to say that public health has to be a primary use case. So we're also launching another work group with the CDC on TEFCA use cases to think about how would public health agencies, not just the CDC, but jurisdictional public health agencies and local public health agencies, be direct participants to be able to access information and hopefully provide information back to providers via commodity pipes, so that you have the on-demand availability of information, as well as the lowest possible cost of being able to have that type of interaction with provider organizations and other stakeholders. So there's a lot to figure out there, obviously, because there's rules around minimum necessary and and local rules as well. But that's all a part of developing the use case. And from our perspective, the most important thing is to get that off, get that launched, and the clear identification that public health is one of the primary use cases of the network. So on the timing on that, we announced in July that the common agreement, which is sort of the participation agreement, as it were, for those who want to participate in the network, will be available for networks to sign in the first quarter of 2022. And here we are in November, and we're still targeting first quarter of 2022 for that to be available. So it's just around the corner here, and certainly not too soon for us to be able to start to think about what does it mean for public health agencies to participate directly in nationwide interoperability networks. So we'll have more to come on that as well, but hopefully that gives you a sense of what we're doing at large with the CDC, and in particular, what are the very specific things that ONC is working on in general with interoperability, but how they intersect with the public health community. Thanks again for the invitation, and really delighted to be here.